Thank you very much for your introduction. And indeed, I have here a very different hat. There's now new challenges coming ahead in ESNO, and that's why we created this foundation to have a lot of activities, very more specific, organized. Otherwise, you're doing too much ad hoc. And this is one of the projects. The other project, the first project, is the one Avra was just explaining, and that was on plasma collection, and that's what's done with the EDTNA. But now this is a project what we're doing with the European operating room nurses. And I'm not an expert on operation at all, but I give a kind of a flavor where we're talking about, and but I will go more towards the policy, and so the first slide is more about the context. What is surgical smoke? So if you look at there should have been a short, maybe I can do it like this. Yeah, it is. As you can see, when nurses working in operation room, these are working under these conditions when the smoke is not being evacuated. And at the moment, we see nurses working in all kind of conditions in all kind of places in the hospitals. But overall, we need to look at their safety. So not only on the bending, walking, but also on the inhaling. And the surgical smoke seems to a lot of the nurses a very small area. Because it's operation, it's only. But if you're taking it, for example, there's so much operations at the moment going on, and the nurses are the ones who are constantly in that room. Then they face a lot of this of this smoke. So this is a big issue for the EORNA, and they created a very clear position paper on this, where they say that the perioperative nurses report twice as many of respiratory issues as compared to the general population. Protection of team and patients for hazardous and surgical smoke is very crucial. And attracting and retaining the best clinicians due to a healthier, smoke-free environment is very important. But also providing education on the risk of surgical smoke and methods for smoke evacuation is essential. So this smoke evacuation is very crucial, and I'll come back to this on my next slide. But I shouldn't forget to mention Michael Allen is also one of the key persons who was willing just to help me with this presentation, because he's at the moment working in a hospital. Well, if we are talking about danger of smoke, there are about 3 levels: inhalation, the chemical, and the biohazards. The inhalation hazard. Well, you don't need to say much more about it. Surveys have been done, a lot of research, and when making this presentations, I came across research in that, and there are maybe hundreds of them. So, but generally spoken, well, if you work there without smoke evacuation, you will be smoking 27 to 30 cigarettes a day. And it's important to realize that 95% of surgical smoke is a water vapor. So you will inhalant. And small particulates less than 10 microns in size can penetrate deep into the lungs, and some may be coming into the bloodstream. Then next we have the surgical smoke contains 40 hazard chemicals. These are toxic, mutagenic, and carcinogenic. And benzene has identified in the laparoscopic surgery smoke. But also benzene diffuses across placenta and is considered as a fetal toxic. So for the unborn children. And last, it's very important to take the surgical smoke as a transfer of disease and possible has been documented. Sorry, sorry, I'm not a good speaker, but we will get. But we need to be aware that during the COVID-19 period, also operation took place, and needless to say that there's relevancy for good smoke evacuation. And also mentioned here in this slide, the Stop Cancer at Work campaign that has been very active lately, and our organization is also very much involved in it. So Stop Cancer at Work is also for nurses. So when starting a position statement, it's very easy to make a statement, but the statement is not only for the shelf. You have to do something with it. First of all, you have to do your homework, to see what are you talking about. Then you need to create impact, and then also do policy and collaboration. Nothing can be done without friends. And this project is starting now, at the moment, with providing an information and communication guide. It's a bit similar like we did with the vaccines and the microbes, AMR, infection prevention control. And we aim to have this published in a week or 4. So the draft is at the moment working by a professional editor. So this is the first. You have to do your homework. Secondly, you have to create impact, and that's first of all the first layer is education and awareness. So see that there's a clean environment, safe working environment. Speak about it and communicate it in your direct environment, but also initiate education. Then the second layer is also go to meso levels. Just seek interprofessional collaboration. If you're developing something, get doctors on the table, get your other healthcare professions, your regulations. And sometimes in the leaderships, nurses sometimes complain, we are not involved. Now you have to also have to think the other way around. We as nurses, we are the persons who need to invite the others ones. So you always, that's why I'd like to stress, work with colleagues, work and make friends. And then the last layer is having it on the political agenda and see that there's a nurse always at the table in leadership. And Paul already gave a very good reason why, and also how. And it's just being at just being at the table. And sometimes they say, well, can you send me a quote? And that's often what I say. If you're not there, you cannot see you. And if you do not speak out, no one will listen to you. So you have to be there. And so it's also good to work in consortium. And also on this topic, it's what we're doing with this project, just with professional organization. At the moment, we're doing the surgical smoke with the EORNA. But we also think are going to reach out soon to the urology nurses and also to the endoscopy nurses. We have to work with the industry, but also regulators and things. We need to see that the studies have been done and publications are available, and at the end, seeing that that policy has been done national, but also European. It's very important that you talk about with your European friends on that if you want to create impact. But first things first, you cannot say, well, doing from one level to another. You always have to work on different levels at the same time. So first of all, if I go back to the EORNA position paper, first of all, removal of risk at the source, and that's why evacuation of smoke aerosols are very important. And that's where I see two examples of the industry. ventilation has to be very well assured on the operation room, and also personal equipment. And we do not need to say much more on this because we had so many troubles on this over the past years. So if I look at the number 1 and number 2, I need to stress that often the nurses have the lead in the operation room to secure the safety of the work environment. And last but not least, education. Well, this is my almost last slide. This is the collaborating process of the EORNA with ESNO, executed by FONSE. And this guide is made possible with the support of Stryker and Johnson & Johnson. And these are the persons who were responsible for the project and helping us with this presentation. And this, if you were interested in a lot of guidelines and safety, just have a look at these references. Sometimes they are boring, but I really encourage people, just read them, just go into them. Because if you want to create policy, you must do your homework, and I'm sure that Paul will agree. Just do your homework well, and just make friends, and if you want to make to be effective. This is my slide. Thank you for your attention.